Hey guys, I'm back with our respiratory drugs today. So we're going to learn all about kind of the respiratory system, how drugs affect it, and you're going to be going through the respiratory drugs and memorizing them this week as well, if you haven't already started that. So I'm going to present so you can see my screen. Okay, I think you can see it. So now I'm going to start my slideshow here. Okay, so respiratory drugs and allergy drugs is mainly what we're going to talk about. I guess really anything upper respiratory because you've got upper and lower respiratory and things that can affect it. So Airway Basics, we've got this is a bronchial tree. You may have seen this before, but you've got your trachea or your windpipe, you might have heard. And then it kind of branches out into bronchi, then bronchioles, then alveoli. So these would be the bronchi, the big things that come off the lungs. And then those little bronchioles are like the little branches. And then the alveoli are the little tiny things that are on the very ends of it. And that's actually where the diffusion of oxygen occurs. That's what they look like there. So asthma is one thing we're going to talk about a lot because it's a really common issue. I mean, pretty much every class that I've had someone in my class that has had asthma. You know, I have family members with asthma. So, and even with this COVID thing happening, a lot of people have talked about that, you know, asthma can be, if you have really bad asthma, it can cause you to have problems with COVID because you already have like a existing condition that causes your lungs to not be able to breathe well. Normal airway looks similar to this, or this is a normal lung, like cells in your lungs with the, but as you can see, they close up. These bronchioles will close up. So then airway basics. So again, this is a normal bronchiole. This is an asthmatic bronchiole. It just, go back. It swells up so that air can't get through. The effects, it's worsened in cold, dry air. And exercise-induced or allergy-induced is very common for asthma. Like if you've ever heard of exercise-induced asthma or allergy-induced asthma. And then COPD is kind of, you could call asthma a type of COPD. Chronic obstructive pulmonary disease is a large name, or it's a big name for a bunch of different lung diseases. Used to, they would call it, the smoker's disease, a COPD, but that's not actually true anymore. There's a lot of different lung diseases that can be classified under COPD. And that's just a cute picture of a cat getting a little lung treatment there, I think, a breathing treatment. Okay, so asthma attacks may be triggered by inflammatory responses like mucus production to rid an irritant, or bronchospasm, where the bronchial constriction happens to limit the irritant going in the lungs, but that's actually bad because it closes up your lungs and doesn't let air come through. It's typically managed medicinally, so with medications. You have controlled medications. A lot of controlled medications for asthma are pills nowadays, and then you've got rescue meds, metered dose inhalers, things like albuterol inhalers, things like that can help open up the airways. So respiratory drugs for asthma or COPD, you've got bronchodilators used to combat bronchial constriction, and they can be steroidal or, then you've got anti-inflammatories, which can be steroidal or non-steroidal, and you've got oral medications as well. For some reason, I didn't put examples here, but you'll see those examples in most of this PowerPoint. But some examples you will see on your drugs list, your respiratory drugs list. So make sure you get those in there. There's a lot of bronchodilators on there. Specifically, albuterol is one really important one. It's usually in a rescue inhaler. That's a common one that most people will have if they have asthma or COPD. So drug classes affecting the respiratory system as a whole, you've got antihistamines, antitussives, drugs for COPD, like I said, decongestants and expectorants. And this is for like for the gamut of upper respiratory issues. So this is not just COPD or asthma, but this is for if you get sick with an upper respiratory infection or a virus that affects your respiratory system, anything like that, even allergies, like all of that's going to be helped by some of these drugs. So antitussives, remember that's anti-cough. So you need to remember that cough suppressants are antitussives. That's just another word for it. That will always be a question on the test. They'll want you to classify a certain medication as an antitussive. Usually they ask about dextromethorphan or Robitussin right here. That's a really, really common drug used for coughing, specifically just coughing. Benzonatate, Tessalon pearls, those are common. They are prescription only, as well as Cherotessin AC, which is prescription only. The only one that's not prescription that's OTC is Robitussin. So Cherotessin AC has codeine in it. Codeine is a scheduled drug. It has antitussive effects, and that's why it's in a lot of anti-cough medicines. But again, you have to be prescribed that. And then the typical like side effect of these could cause dryness of mucosal membranes, constipation, nausea, and dry mouth in some patients. And one other thing you want to remember is Cherotessin AC or anything with codeine is usually a Schedule 4 drug. It doesn't have a lot of codeine in it, and that's why it's a Schedule 4. All right, mucolytics and drugs for COPD. So mucolytics thin mucus and are indicated for those who have COPD, cystic fibrosis, pneumonia, or tuberculosis. All of these could be considered COPD, like cystic fibrosis, I think, is one of those that is called a COPD disease. And mucolytics cause an increase in secretions, but a lot of times they'll thin those secretions to kind of get them out of your body. This can be in many different types of drug classes, actually. So under mucolytics, you could have bronchodilators, expectorants, leukotrienes, steroids, antibiotics. So there's like a lot of different, there's like subclasses of mucolytics. Patients are told to drink water to help the medication work better. And the biggest example of this, or probably the most common, is Mucinex or guaifenesin. It's a mucolytic that thins the mucus, but it's also an expectorant, meaning it makes you cough up that mucus to get it out of your lungs. So not only is it going to thin it out, but it's going to help get it up as well. And this I've taken plenty of times when I've had, an upper respiratory infection or something like that, or just like a cold. Okay, bronchodilators and inhaled steroids. These open up airways that are partially closed due to inflammation. These are helpful for patients with COPD, asthma, upper respiratory infections, and like I talked about earlier, an inhaler with albuterol. Singulair is another common medication. Nasal steroid like Nasonex or Flonase. All these drugs can actually increase heart rate, increase pulse, sweating, and nausea. So that is some side effects that they have. And most of the time they're inhaled in some way. Okay, and then decongestants. So we've talked about decongestants actually quite a bit because at the beginning I talked to you about pseudoephedrine and how pseudoephedrine is one of those that's behind the counter. They always ask this question every year on the test about the 9 grams per month or 3.6 grams per day rule because it's regulated. So it's one of those things that you need to remember. So you need to remember that decongestants, what they do is they relieve nasal congestion in the upper respiratory tract. So they kind of help open up your nasal passages, especially if you have something like, a sinus infection or sinus problems, even sinus allergies, this can help with. The active ingredient in most decongestants is either pseudoephedrine or phenylephrine. Phenylephrine is actually not behind the counter. You can buy it OTC. It's not as strong as pseudoephedrine. Pseudoephedrine is, or Sudafed, you have to buy behind the counter from the pharmacy. The pharmacy tech that checks you out will take your picture ID and it goes into a system through the database, the state database, and it will basically like put in the system like how much you've bought for that month. They do this because, remember, pseudoephedrine can be used to make meth, like methamphetamine. So that's why it's regulated and it's behind the counter. But again, you don't need a prescription. And then last but not least is intranasal corticosteroids. They can be used as decongestants as well. These are like these nasal sprays that you spray up your nose and it kind of clears your nasal passages. These are good. They work really well, but they can also actually cause rebound congestion. So I think that's like a last resort type of thing. Like people don't use them very often because of that, because what happens is they will start to work, but then your nose and your nasal passages start getting used to having just that in there. And so if it doesn't, it'll just constantly be like inflamed until you use it again. And so it's almost like you get too used to it. So this is not something that I would consider like a long-term solution. If you have like sinus problems, it probably will hurt you more than it'll help you. But that is available over the counter as well. And then expectorants. So we talked a little bit about expectorants a couple slides ago because of Mucinex. So expectorants are a medicine that produces those secretions of sputum by the air passages, and it's used to treat upper respiratory infection. This is the first line here is really just an easy way of saying it makes you cough. It makes you cough up stuff. So for example, guaifenesin, it will make you cough. It'll make you cough up the stuff that's in your lungs so it doesn't stay in there. This can actually help, prevent pneumonia from happening, where pneumonia is sometimes can be from just the secretions becoming too thick and staying in the lungs and not being able to come out. So this helps a lot with that. Patients are also told to drink water to help mucolytics, expectorants, and decongestants work better. All right, and then allergy drugs. We're almost done, you guys. So there's a couple different kinds. The main ones are antihistamines, which treat acute allergy symptoms. And then you have epinephrine, or an EpiPen, you've probably heard of this before, treats acute severe allergic reactions that close airways. So this is something where you will die if you don't have this, the EpiPen. Most schools have an EpiPen just in case something happens with kids. Sometimes, someone can like have a food that the allergy they didn't know about, or allergy to a bee sting they didn't know about because they'd never been stung by a bee, and this happens and it's really scary. So this is one of those things that is a lifesaver, literally. And then drugs that treat minor allergies, seasonal, like pollen, dust, ragweed, would be Claritin, Zyrtec, and Allegra. All of those are antihistamines, and we'll talk about them, I think, in the next slide. So antihistamines are also called H1 blockers. They block histamine in the body. They relieve respiratory symptoms caused by histamine, so allergic rhinitis, allergic sinusitis, hives, and swelling. So sometimes when you get like a runny nose or a stuffy nose because of allergies, these can help with that. They also treat allergies and allergic conditions. And the biggest side effect is drowsiness or dry skin and mouth. Drowsiness is more with something like Benadryl or diphenhydramine. That's like the #1 antihistamine. It works really well, but it does make you really tired. That's like its side effect. And then Allegra or Zyrtec, these are good for like during the day allergy medications. Even like Claritin is another one. I think the most common one's Zyrtec or cetirizine. This is one that, again, all of these are over the counter. This is probably the one that doctors they recommend because you can buy it over the counter. Yeah, and then that is it. So that is your respiratory drugs in a nutshell. I'm going to stop presenting here. So hopefully you guys have already started your drugs list. Ms. Walsh will be going over them with you and making sure you have the right answers. And you need to study these and learn these because they are really important, and most of the time they will come up on your certification test. All right, guys, I hope you have a great day. Bye.